for everyone to understand what we mean by breast cancer and how can today we all together can early detection, self-examination, and increasing our awareness, we can reduce the rate of breast cancer among the ladies all over the world. So today I will be taking you through these slides. The slides is just to guide us about some facts and numbers and some pictures. At the end of this session, or maybe during the session, if any of you will be having any questions or any queries, please, I will be going through the question one by one. I'll try to answer these questions. So again, welcome to our important breast cancer awareness, and we will be starting now our slides. So as we know from the breast cancer, so if we go to the why it's really important for us to know how the breast cancer develop or what are the main risk factors, or even if there is a genetic and what are the main cause of the breast cancer. Before even going through what are causing the breast cancer, it's really important for us even to know what is the anatomy of my breast. What is my breast consist of? Why we always get the breast lump or cyst or the cancer easily in this area. As we see on the screen, our breast, if you look to the breast anatomy on the picture, which is down the slide, it's always consists of multiple fats, or we call in Arabic duhun, and breast tissue, ansija wa duhun. So this is why, because the anatomy of our breast, it's mainly fats and tissue, it make it easily to develop any kind of the cyst, or maybe can be lump, or even it can be duct or any other inflammation. The other things, if you look to the picture on the down, we can say a complex of network. So it's like a loops and there is a duct, al-qanawat or al-qanawat al-halibiyya. So the main function of the breast, as we know, is breastfeeding. It also have the other function is like regulating some other hormone in our bodies. So the main breast changes can occur over the woman's life. So whenever we are getting starting from our first menstruation, from the pregnancy, after the pregnancy, lactating, and even reaching the age of menopause, our breast will always start to be change and change and change. And the tissue and the cells, which is we used to have them, over the time, for sure, they will start to be changed. And we will go through what are the main factors that might lead to these cells or the breast cells can be changed, or it causing sometimes to be a harmful changes for the cells, which is we need to take care of it. And definitely we need to seek a medical attention. So if we go back to some facts on the breast cancer, as we say, the breast cancer is a leading cancer among the women worldwide. So the last statistic, as we see on the screen, is really huge. It's more than 2 million ladies among the world. They are unfortunately diagnosed or even being, had a complication from the breast cancer. So these studies based on 2018. And as we know, more than 626,000 ladies unfortunately die from undiagnosed or a late stage of breast cancer. So this is why we say breast cancer is really important. If we early detection, the quality of life and even the treatment will be easy for the patient, his family or her family, and also for the treating doctor. As we know, always we say among the ladies, if we count, they say like in every 8 ladies, you should find like 1 lady might be at risk of having breast cancer, or even she's having starting or some sign of the breast cancer, but she is not aware of it. And unfortunately, as per statistic, every 15 seconds, the ladies among the world has been diagnosed with the breast cancer. So is this a little bit, like the statistic and the numbers is a little bit like worried numbers. So we have to take an action to reduce these numbers together. Okay. So, and as they mentioned that every woman, or like every 50 seconds, there is one woman die from the complication of the breast cancer. Okay, so we are still continuing on the what are the statistics, or what are the more facts I need to know about the breast cancer, why I need to know these numbers, and what will motivate me to take an action as soon as possible. Okay, so breast cancer usually targeting the woman, and as we know, it's considered the most common cancer also in Abu Dhabi, Emirates of UAE. Breast cancer is the first leading cause of death among the women in UAE and Emirates of Abu Dhabi. Based on the statistic on 2016, around 12.1% of the women being diagnosed with the breast cancer. So again, this high number, 12%, is really a high number that we have women among us in UAE, especially this is in Emirates of Abu Dhabi, they have the risk, or even they've been diagnosed with the breast cancer. So usually most of the patient, when they are first time diagnosed or something, they will always ask, what is mean of the cancer? The general meaning of the cancer, anything goes wrong, or as we say, break the rules. As we know that our body and cells, they keep regenerating, they keep changing from time to time. What will happen during the cycle of the cells change? During the cycle of the cells changing, or even like regenerating, if there is genetic factors is there, or let's say mutation, or طفرة جينية, sometime what will happen? These cells will rapidly grow, and instead of growing a normal cycle, taking its time to present me a good and healthy cells. And instead of that, it will start to grow very quickly, rapidly, and start to attack the healthy and the surrounding cell, unfortunately. تتكاثر بسرعة كبيرة and start to attack the normal cells, or the neighbor cells, as we say. And as we say, there might be many factors, but most of the cause, as per studies, there might be as a gene mutation, طفرة جينية. Only, so this is very important information, because all the ladies think that, oh, so that means I might have this gene and I need to test it. So as per study, 5 to 10%, they are only due to the inherited gene mutation. So that means the rest of the causes of the breast cancer, they might not be to the gene. There will be other risk factors can lead to the breast cancer, and other than the gene mutation itself. So there are two main genes, which is we always need, or sometimes you see the doctors mentioning them sometime during the examination or your investigation, or sometime in your history when they are asking about the family history. So they might ask you, have any of your family been tested for BRCA1 or BRCA2? Or have you ever had an ovarian cancer? سرطان المبايض. So this is usually, if your doctor asks you for that, that means the doctor want to know if your causes of cancer is linked to gene, or it might be other risk factor or other causes. So BRCA1 and BRCA2, we don't use this test very openly. We don't use this test like on the routine base. It's only based on your family history and your personal history, your past medical history, and also if you had one member of the family or two had been BRCA1 or BRCA2 positive. So this is the main cause. What is the cancer of the breast, as we say, where the cells in the breast tube, they divide and grow without a normal control. And as we see in the picture below that, if I just move the mouse here, we can know that there is a fat tissue is here. And sometimes always you will find there is something abnormal or inflammatory film. So if you can see, there is a small dots here. Okay, so it's like what we can have many changes in the breast. Not all the lumps we found in the breast, they are cancerous or they are cancers. No, if we look back to the tissue or we look back to the breast cancer, to the breast image, some of them, they are cysts, like a chias, normal cyst. Some of them can be abscess, or it can be just a small abscess sitting there. Some of them can be just inflammatory cells, they can be there. So these are usually we will be doing investigation more and more, and some of the abnormal one, which is we suspect it might be cancerous, your doctor might advise you then to do biopsy or to go for the further testing. So this is, again, it's very important for us. Not any abnormal lump in the breast can lead to, it can be cancer, but it's further, it's need, that mean you need to test, or you need also to go to seek a medical advice as soon as possible. So now it's really important, if we just go back now to see what are the stage of these cancers. As we know, this is why we say early detection can save lives. Why? Because cancer, when they grow up, they don't grow up and they just suddenly attack your cells or your body. No, there should be some starting point, usually we call it, or we call like a very starting, or the stages. So stage 0, as we see on the picture here, okay, that means that there is cells like abnormal cells, but they are still attached to one layer of the muscles. So they are, we call it localized, موقعي, and they are very tiny one. If they early detected, the treatment and even the quality of life can be really high, because when they are only in a small area, so you have better control on them by just removing them and treating if they need it, followed by radio or chemo can be easy. If we move to stage 2 or stage 1, as you can see in the picture, it's a little bit going, you know, beyond the cells or beyond the muscles one. So it's starting now to expand and to go to the next level of the muscles. If we, let's go to the stage 3, or we can say stage 2A, stage 3, and we have a stage 2B, and we have a stage 5 or stage 4. So, and because of the position of our breast tissue, and we have nearby, you know, like a channels, we have the lymph nodes is nearby to our breast, and we have the bloodstream. If you can see one of the picture, and there is like a green dots around there. So what will happen? Usually, if you're having cancer, which is just sitting near to your lymph node, this can be sometimes easily spreading through the lymph node to the other part of the body, unfortunately. Even if it's like starting or growing near to the bloodstream, again, it will be easy for the cancer to spread out through the whole body by just, you know, like picking up what is the easy way for them, either the lymph node or the bloodstream. So if we see to the pictures again, because this image for me is really important, and usually the patients coming always, what is the treatment? I usually, or we as a doctors or surgeons, it depends on what the stage of cancer you are. As you see in the stage 4, where the lump is bigger, and the spreading of the cancer almost outside the local area, it's already start to spread to other organs or distant lymph node. That means I only don't need to treat only the cancer for this area. I also need to consider treating the other adjacent and organs also, and make sure that it didn't metastasis. Metastasis means it start to spread and to invade the other normal cells. So these are the main stage of how is the breast cancer developing. This is why we always wish the very healthy, wealthy state for everyone. If always they are in stage 1 or stage 0, below stage 2, it's easy for us sometimes, even for the treatment, and as I mentioned, the quality of life for the patient. So if we go to the risk factors, usually, so many patients sometimes, if we dig in their history and we do the full assessment for them, some reason can be very shown and can be very clear to us what causing it. But unfortunately, on the other hand, some of the reason can be unknown. So in this case, we call breast cancer with unknown reason. Because you do all the tests, you do the genetic testing, you check the family history, there is no family history, you check the risk of using any long-term medication, there is none, and you check the patient's lifestyle. It's a very healthy lifestyle. But again, sometimes you could not find a reason. So these are based on the studies. So they gathered all the information just to tell us what might be the direct or indirect, or we say modified and non-modified reason for breast cancer. So modified or modifiable reason or the risk factors, these are the things. which is sometime, as we say, you can make a change to it, or you can do an effort to change them. So they are modified, they are able to be changed for better life and quality. It's in your hand. So this is why usually I say for the patient, these risk factors, you can change them, so still you have chance. So what are the most of them? Smoking and taking some, let's say, drinking alcohol and other things. Inactive, physically inactive, which is mean you are physically inactive, you are always overweight and obese. Again, these are the risk factors, which is based on the studies. Okay, so they said one of the risk factor can be if you are obese and you are overweight and you are physically inactive. That can be risk of developing not only the breast cancer, I will say, all the other chronic morbidities. A diet rich in fat or red meat and poor in fiber and fruits. Again, this is based on the studies. These studies still going on, but again, they link that there is somehow there is a relationship between what you are eating on the daily basis and what might be causing the breast cancer. So this is why when the breast cancer survival, usually we put them on like a very, very healthy diet. And we advise them to keep away from sugar, from fat, from any like a canned food and other things, and stay healthy as much as possible. It's not only because they've been recovered from the breast cancer. It's also a general advice usually we give for the all people, ladies and gentlemen, whenever they recovered from any condition or comorbidities. This advice usually we give for the advice for the diet. Not breastfeeding again, so it's, as I told you, it's only based on the studies. Some of these studies need to be updated, or some of them need to give us like a new study or extend their study. So they said if the ladies, if she's not lactating for the long time and there never been a breastfeeding, she might be at risk of developing a breast cancer. Current or recent use of birth control pills. So we know that most of the birth control pills, they are hormonal. And one of the risk factor is to be on hormonal tablets for a long period of life, more than 15 to 20 years being on the birth control pills. So as we mentioned, it's not direct cause, it might be a risk factor. So whenever a lady is on the hormone or the birth control, we advise her from time to time, do a checkup, do a self-examination at home. Seek a medical advice from your family medicine or from the gynecological doctors. Always make sure that you are on this medication and you are safe to continue on this medication if it's not causing you any hormonal disturbance or not causing you any other problems in your body. Okay, so if we go back to the other risk of modifiable, which is we say it can be changed, currently or recently using combined estrogen and progesterone hormone replacement therapy. It's called HRT. Okay, usually for the hormone replacement therapy, the ladies who are entered already early menopause, سن الأمل المبكرة, or the ladies who have ovarian failure, عندهم فشل في المبايض المبكر. You will see that the doctors will be starting to putting them on something called HRT, combination of the two important hormonat أنثوية, estrogen and the progesterone. Usually throughout our life and youth, we have these two hormones in our body. And these are the two hormones give us the features of feminine, اللي هي العلامات الأنثوية. But later on in the life or for any other reason, they might stop being produced in our body. And this is why we'll be having no estrogen and no progesterone, which is leading to other symptoms like a menopause, علامات سن الأمل, which is not our subject today to speak about it. But again, so if you are put on HRT, for sure your doctor make sure you are doing your mammogram on annual basis, and also you are checking your ovaries and uterus that you are not being exposed or you're not be developing any type of cancers. The last one, never having children or having your first child after the age 35. Again, these facts are based on these studies, and sometimes some studies are limited, but they tend to say if you never had been married and if you didn't have or you had the first child after the age of 35, you might be at risk of developing the breast cancer. Again, we say these are the things which is modifiable, which is mean we can change them somehow, or it's a patient's like a lifestyle. So we can always advise the patient to change these things for the better outcome. So on the other hand, let's say if we go to non-modifiable or the other risk factor of the breast cancer. So we say in one hand, we have the risk factor, which is in our hands, lifestyle, diet, obesity, hormone use, not getting married in early age or getting married in the later in the age, or family history, other things, not being physically active can lead to the risk. What are the other risk factor, which is sometimes we'll tell the patient, unfortunately, it's out of your hand, which is you cannot change them. First thing is being a woman. So being a woman and you having a breast, which is full of the tissue and full of the duct, which is mean you have the risk of developing breast cancer, unfortunately. Getting older, as we know, in the past, we used to always to study and know that only the breast cancer happened when you are age 50 and above. Unfortunately, recently, based on the studies, we noticed that the breast cancer can attack anyone at any age, but most probably like an age of 40s and above, but anyone below 40s can be at risk of having breast cancer. Having an inherited mutation, as we mentioned, BRCA1 and BRCA2, breast cancer genes. Again, these are the things which is you cannot make a change and it's out of your hand, unfortunately. So in this matter, it's only that you need to be tested if any of your family has been positive for BRCA1 and BRCA2. So that can be asbab geniya, which is mean it's out of your hand. You cannot do, it's not based on your lifestyle, other things, but still you need to make some changes in your lifestyle. Family history of breast cancer. This is very important questions for us whenever we get a patient. The first thing I will ask them, do you have any family history of breast cancer? Do you have any mother, grandmother, sister, aunt, daughter, anyone with the breast cancer? I also will ask about the ovarian cancer, if one of you can answer. Why ovarian cancer? Because if we think that ovarian cancer, breast cancer, then we are asking about, or we are thinking about BRCA1 and BRCA2, which can be linked sometimes, unfortunately, to each other. A personal history of breast or ovarian cancer. Again, this is the similar thing, which is I mentioned. If you had a history of ovarian cancer in the past, then that means you are at risk to develop a breast cancer, unfortunately. Or if you had a personal history of breast cancer and you've been treated for the breast cancer, that means you still need to be followed up every 6 months to 1 year after recovering from your breast cancer, just to make sure you not develop a new area of the breast cancer. Okay, so still that will put you at risk of having breast cancer. Dense breast. If we look to the dense breast, usually if you are doing a mammogram, your doctor might sometimes tell you, maybe it came across you and telling you that you have a very dense breast and I think you will be needing an ultrasound. That's very true. Most of the lady, they tend to have very dense breast. And this is like, as we say, it's an anatomical things and it's different from a lady to a lady. You know, like our body, there's some changes happen, like some ladies tend to have a dense breast. But don't panic. If you have a dense breast, it's again, it might give you the risk of developing breast cancer, but you might see sometime the radiologist or your physician might asking you, if you have a dense breast, please make sure that you do your mammogram frequently, like maybe every 2 to 3 years, and ultrasound sometimes, just to not miss any abnormal mass or lesion. The last thing, having a previous biopsy showing hyperplasia or carcinoma in situ. So hyperplasia from the name hyper, which is mean the cells being growing in very fast and very quick rapid form. Carcinoma in situ. Carcinoma in situ mean that the cancer, as we saw the pictures before, in the stage 0. In stage 0, that means the cancer is still very localized and very small area. It did not cross the cells and the muscles and did not cross the border yet. So that means, again, if you have any small thing in doubt or in the cancer's just starting, you might find your doctor saying you, let's remove it, or let's do a very close monitoring of that cancer. It's like by doing frequently ultrasound or maybe annual mammogram. Okay, so that can be also, as we say, these are the risk factor. Unfortunately, if you have the breast cancer linked to one of these causes, again, this is out of your hand, especially if you're being a woman and getting older, and also if you have BRCA1 and BRCA2 gene. Okay, so these basic things, because that will usually give you also a clue what is causing my breast cancer. Instead of Googling in the Google or starting to ask the others, it's better to be aware from it from the beginning. Now, maybe you all see there is a picture. I always like to show this picture to my patients, or even to my, let's say, to my customer or client. What are the sign and symptom that my breast is having abnormal thing that I need to go and to be examined as soon as possible? So if you look to the pictures, I don't know if it's clear to you, but I'm trying to move the mouse and I will be explaining to them. The first thing, sometimes the lady will notice that sometimes there will be like a dimpling, or the skin of the breast look like a skin of the orange. Okay, it's not like a clear skin or soft skin, and might be like alerting what's happening. The next picture, if we're going, is the strange fluid, or we call nipple discharge. If you find that the nipple is discharging or releasing a fluids which has not been there before, it might be sometimes milky to blood or bloody, or even sometimes other than that, it can be very yellowish. It's not blood and it's not like milky. Okay, and maybe you will find sometime an area of hardening. It's very hard and red when you touch it. This can be one of the signs that you need to contact your doctor or to seek for the advice as soon as possible. And we can see skin erosion. So what pictures we are showing you here, usually on the reality, this is what usually the ladies present with. Okay, so this is because for the for the confidential and for the dignity, we would like to only to present this image just to show you what you might be found during the breast examination at home. And usually, if you can see the next picture, this is very common. And in this case, unfortunately, if I see a lady coming with the breast look like this, like a skin is went to inward, and I would suspect that the mass is really big. So start to pulling the skin inward and causing the skin to be inverted. Okay, and other things we see like the skin, or there will be like a lump. Sometimes you can see the breast when you do the examination, there is something abnormal on the breast. Usually the patient themselves, 80% of the detection of the lump is by the patient themselves at home. This is why then we come to the next slide or the later slide, why the breast self-examination is really important at home. Okay, and as we go to the other symptoms and sign, we said again, this is look like the orange peel skin, okay, and we have like asymmetrical. Asymmetry, if you can see from the pictures here, the two breasts, they don't look alike, or one breast is bigger than the other, okay? Or the nipple has been changed and the nipple went inward instead of looking the normal anatomy of the nipple. So the next one is, we call it in medical form, nipple retraction. So the lady suddenly, she will come and she will say, I noticed that my nipple is not like a normal, it's been retracted to the inside. So again, I always need to examine and to make sure that this is not one of the signs of the mass behind the nipple, which is retracting or causing retraction of the nipple. Okay, so growing veins, again, do not confuse that with a lady who just been given birth and lactating. We know some of the ladies, when they are lactating, there will be some growing veins, subhanallah, and there will be like the veins, they are very prominent, we call it. Like will be very obvious, you can see them. So please do not mix up that, oh, this veins is very prominent, the doctor was giving us a lecture, that might be something. No. In lactating ladies, you might feel it or find it as a normal, but in other ones, someone is not lactating or not on anything, suddenly you found some changes in your breast, please go and consult your doctor. The last one is the lump, which is the most common presentation of the patient in my clinic. So they always will come and present. They said, I was doing my examination or under the shower, when I was taking my shower, I noticed I have a lump under my arm, or I have a lump on my breast area. So most of the time, will be the main issue when I bring them. And the time when they come to us, they are very healthy looking. They are not in pain. There is no other sign you can say, oh, that might be something abnormal. Only the lump, which is you can find it on the examination, or the bump. Then you say, okay, I found the lump or bump. Let's go and do the next test or examination. Okay, so I hope, inshallah, so far we are all catching up with the information. And then we just go for the breast cancer preventive measure. This slide is really important, and always make sure that you take, like the home take message, or you take the message to home to your beloved ones, sisters, mothers, and daughter. So breast self-examination, or we say breast self-awareness, okay? So know your body. Do the self-examination. I usually tend to ask the girl starting from 18 or from the puberty, like from the 12, 14, 13, advise them start to do a monthly self-breast examination. Because as I told you, 80% of the ladies, they are the one who detect what is abnormal in their breast. And there's something is going on with the breast when they are coming to our clinics or to our hospitals. Okay, on a monthly basis after the menstrual cycle from the age of 20 years. Okay, number 2, clinical breast examination. This is where now you will book an appointment with me. You want me to do the examination. So the self-breast examination where you do it at home, the physical or the clinical breast examination where I do it for you in my clinic, just to make sure after you that if there is any lump, or there is any enlarged lymph node, or there is any changes in the breast bilateral, then I will guide you what to do next. So do the clinical breast examination every 3 years, at least starting from the age of 20. And every year starting from the age of 40. And at any time, just keep this message, at any time, if you suspect that there is a lump or there is abnormal things from the nipple discharging, or the nipple look abnormal. So that means you need to come and do the clinical examination as soon as possible. Mammography. I don't know if any of you been to mammography or to the radiology department for mammography. So all women age 40. In UAE, we have our guidelines from the Department of Health. Any ladies age 40 and above should undertake a screening mammogram every 2 years. Again, it might be you are below 40s, but because of the high risk family history, genetic mutation, and maybe you're having breast cancer in situ, then you will be asked to do the mammograph regardless your age. Okay, so these are the 3 major things, as I will say, protective: al-waqaya, self-examination, al-fahs al-shahri, clinical breast examination, al-fahs al-sariri, mammogram. Okay, so how do we prevent? Usually, as we said, the studies and the researches, they all came together. They say, at least let's support the ladies. Let's give them the hope. Let's give them this, that there is something they can do to protect at least themselves and to keep themselves healthy and away from the breast cancer. So if you are a mother and if you are a pregnant lady and you will be delivering soon, we always encourage the ladies for the breastfeeding. So as we know, the breastfeeding, it's not only to prevent from the breast cancer, it's also helped to regulate your other hormones and even the uterine contraction, other things. Diet or the healthy diet. Always try to keep on healthy diet. Try to avoid too much fat, carbs, and calories in your meal. Start to be active a little bit. This is, as we say, regular exercise. Regular exercise can start from just walking, because sometimes the patient asking me, does that mean I need to be involved in one of the gym or to do this or do the cardio classes and everything? I say, if you just keep walking, and if you just keep the habit of walking in your life by walking 30 minutes at least 3 times a week, and then followed after that 1 hour 3 times per week, that is enough for your circulation, for your body, and even for the mental health. Okay, avoid hormone as much as possible. So again, be careful with the statements. We don't say do not use the hormone. Try to avoid it. If you are a menopause, or if you are early menopause, or if you're having early ovarian failure, your doctor might give you more of one of these solutions. They might, like give you, they say, go for the lifestyle or non-hormonal treatment. If it's failed, then we need to follow the other way and to start the hormonal. But if your condition is not like you are not coping with the non-hormonal medicine, or maybe you're having some other complication which is need that the use of hormone, your doctor for sure will be following you up closely to make sure that the use of hormone is not the opposite side. It's not causing you any negative effect on your body. Quit smoking, because again, as we said, smoking can be one of the cause or risk factor leading not only to breast cancer. As we know, smoking can cause the oral cancer, lung cancer, all the type of other cancers. So this is why when you're doing these things, you are not just saving yourself from not having a breast cancer, you're saving yourself from not having, in general, other comorbidities and medical condition in general. Okay, so these usually our advice for the ladies and for the population when they are coming and asking, how can I prevent myself from not having a breast cancer? Again, if you look to these are all the risk, which is, or the modifiable, as we discussed in the previous slide, which is easy for us to change. And as I told you, it's based on your lifestyle. The other one, which is I told you, it's out of your hand, if it's a genetic changes, or if it's happened already because you have a start of the breast cancer, or if you're having history of ovarian cancer, that the things usually we cannot change. We only can protect the patient, give the good treatment, follow up the patient on a regular basis, just to prevent the complication of the disease. Okay, so this is very important. As I mentioned, I think that in the beginning of this slide, the most changes which is ladies happen in their breast, they are harmless, but they still need to be checked. Okay, so again, if we say don't ignore them, if you find a lump, if you find skin changes, if you find like redness of the skin, or even there is some changes around the nipple side. So that's mean they are there. They might not cause any harm, any problem, but it's better for them, at least, or better for you to be checked for them and to make sure that let the doctor determine to take the decision. What are they exactly? Do not ignore them, because sometimes in some of the communities and culture, the ladies, whenever she found something abnormal in her breast, she will be shy to going to seek the medical advice, or she will think that it might be a normal and I don't need to be checked now. Later on, maybe I'll just delay it after a few months or maybe after 1 year. It's better to be checked early, just to be reassured, and doctor at least to give you then the best advice what to do for the next step. Okay, so this is usually what's the breast. Do the men get the breast cancer? So this is usually we get this question most of the time. Do the men get the breast cancer? So the answer for that one, usually we will say yes. So the breast cancer, unfortunately, can affect the men. But as we say, it's a very rare. It's more common in the ladies where they have the dense breast tissue, where they have more duct, where they have more hormones is playing in their body. But still, men can get some kind of the breast cancer, and it's very rare. And if we look to the statistic, they will say for every 100 case diagnosed among the women, one man can be having a breast cancer. On the other hand, we say each or for each 8 ladies, we will see one lady might be affected or might be having breast cancer, which the number is really huge. And comparing to the male, it's each 100 case of the breast cancer, one male or one man can be diagnosed with the breast cancer. So the symptom of the breast cancer in men, they are similar to the women. So still may be having some lump, changes on the breast skin, changes in the nipple, also maybe have prominent veins, and that should be also, we will advise them to be reported immediately. And for the men, to be honest, whenever they found something abnormal in the breast area, they always go and seek the advice as soon as possible. They never delay it. So we know from the men, whenever they see something abnormal and should not be in the area which is not designated to be on it, so they always come and seek for the help, and they will ask the doctors why I have this redness or this lump or this change is happening in my body. Okay, so usually, and for the men, it's very important as women, as we say, encouraging. Okay, it's important role encouraging the women of this family to examine themselves to make sure that the incident of the breast cancer is prevented. So the role which is the men can do in the female's life is to encourage them to go and do the breast examination and to do the breast screening. Okay, and we are very thankful for them to reminding us for this. Okay, so if we say how to support breast cancer patient, so if you go to the www.simplycheck.ae. Okay, this is the list of the support group available for cancer patient support. As we know, breast cancer is a disease that affects the whole family, because whenever the ladies or a female being diagnosed with the breast cancer, you can find the whole family will be sometime advised to go do the screening or will be in worry what will happen next. So this is why the support is really important. And some of them sometimes looking how can I support my family, or how can I support my sister, my mother, my wife, if she's been diagnosed with the breast cancer. You always can go and log in or check in on this www.simplycheck.ae and get the information, whatever you know. It's a very simple website. Most of the time you can get the answers to your questions and everything. And again, how to support breast cancer is by spreading the awareness around your community. Okay, if you receive this information, let's say today, it's really good to be shared with my family, with my community. If I am a teacher, with my colleagues in the school, and if I'm a mother, with my daughters and with my sisters and mothers. And if I'm male, it's good also to be shared with my family, my wife and sisters. So by this means, we can support our patients or ourselves from the breast cancer. And also is to be involved in the community. Wherever there is breast cancer awareness campaign and things, we always would like to see the UAE citizens and even the local and also the people who are living on UAE to be involved in this campaign and support and to encourage us or support us to increase the breast cancer awareness among us. And there is many means where we can increase the breast cancer awareness by spreading a breast cancer leaflet or facts or information about the breast cancer in the community, by be involving in one of the group which is supporting the breast cancer, by even also involving or being engaged in the campaign. Whenever you are engaged in the campaign, you will know more about this condition, and you know more about what is the need of supporting the ladies, especially with the breast cancer, who have been diagnosed with the breast cancer, and also who been survived from the breast cancer, because the importance of the life quality after the breast cancer treatment is really important. the ladies after recovering, after from her battle with the breast cancer, she will need also to reconsider changing some major things in her life, like the sleeping pattern should be very good, her food and level of exercise should be optimized, should be high, the stress level should be always low as much as possible. And plus, she will also be need a support group like us, physicians, doctors, psychologists, and psychiatrists to always support her. And whenever she will need any medical information, anything for her. And also, we should not forget the role of the family and the community also to support this group of the from the community, because as we know, ladies, and whenever they take care of themselves, they can spread love and they can take care of everyone in the community. So we'll just go through if there is anyone have any questions, so I can go through the answers. And I hope this session was very beneficial. I tried as much as possible not to go in deep about the treatment plans and other things. As we mentioned in the beginning of the slide, always the treatment plan, it depends which stage the patient is in the breast cancer and what are the, because the breast cancer, it has many types, and the type of the breast cancer patient has, and also depends on the patient other comorbidities, lifestyle, and even the family history and genetic differentiation. Okay, so I can see here on the live, they are very calm and quiet. So I hope if we can grab, if there is any questions from the audience. Okay, so in the final screening, I would like to say, because if whenever you are just log into www.simply.ae or the DOH, you will see there is always a list of registered breast cancer screening in Abu Dhabi. And we as a MediClinic, as you see our logo, we are also a part from this campaign and part of this awareness. We also have a breast cancer screening in Abu Dhabi. So this is just to increase your knowledge, because sometimes people will be asking and Googling, where should I go for screening for my breast cancer? And I just left the logo for the MediClinic. And because I am also from MediClinic Airport Road Group, you are more than welcome for any consultation, any screening, or for any examination for that. Okay. So anyone have any questions? We still have a few minutes. Okay. So please, you will be seeing around the hospitals now, around the clinics now, in the schools also. They all started the pink month. They started now to spreading emails and also screening programs in most of the clinics and things. Try to be involved in this, spread the awareness around you about the breast cancer, because based on the new studies and the new treatment plans and everything, whenever the early detection happen, you save a huge quality of life, as we say, and it's also improved the patient's quality of life and back to her normal life as soon as possible. Okay. So I can see some few just being joined here. This was a brief for our session today about the breast cancer awareness and what is the importance of the preventive, like breast self-examination, and how can we prevent ourselves not to be having the complication of the breast cancer. So self-examination from age of 20 and above, early every month is important. And if you are aged 40 and above, so it's the time for you to book your nearest mammogram and to seek for the clinical examination or to come for the consultation. Okay. So I hope, inshallah, everyone enjoyed this session, and we wish for everyone, inshallah, very healthy, wealthy lifestyle, inshallah, and have a very good evening to everyone, inshallah. Thank you very much for listening. My name is again Dr. Zahra Albloushi from Mediclinic Airport Road. Thank you very much. Thank you. شكرا، يعطيكم العافية أستاذ عمر، شكرا.